Welcome everybody to today's webinar. My name is Faye McGuinness. I'm the Head of Workplace Wellbeing Programmes at the mental health charity Mind. I'm coming to you from my dining room in East London. I think some of you have been in this dining room over the past couple of weeks, so welcome back. And today is the fourth webinar in our Mental Health at Work Commitment series. And I'm really proud to say that we're delivering these in partnership with the CIPD, Business in the Community. This is me and the City Mental Health Alliance. But today we're coming to you from the Mind team. So I'm really pleased to have my colleague Dane joining us, who is our Head of Workplace Wellbeing Services. And he's going to be presenting some really useful practical hints and tips, looking at the particular standard that we're focusing on today. And that standard is to increase organisational confidence and capability. So before we get into the meat of the session, just to say that we are recording and the recordings will be saved on the Mental Health at Work website for you to access after today. Can I ask everybody to stay on mute? But if you have any questions, please post them in the chat function and we will be having a question and answer session at the end. So I just wanted to start by setting a scene and saying a little bit more about what the Mental Health at Work commitment is and why we need it. So the Mental Health at Work commitment, quite simply, is a set of 6 standards that we believe all organisations should be implementing to prioritise the mental health and wellbeing of their staff. And what it will allow you to do is to think about how you promote wellbeing for everybody, how you tackle the causes of poor mental health in the workplace, and how you provide support for people that have mental health problems. So there's quite a lot in the 6 standards. But we're not saying that you have to have completed them in any given time, that you have to complete them to sign up to the commitment. They're all about helping you on your journey of making sure that staff mental health is a priority for you. But by following the framework, by following the 6 standards, you can be reassured that you're looking at those 3 buckets. And so why do we need to do this? So before COVID hit, there was some research done by Business in the Community back in 2019. And what that showed is that 51% of people felt comfortable speaking generally about mental health in the workplace. So that means that actually there's still a big percentage of people that weren't feeling comfortable talking about mental health. And what they also found is that for those who had experienced poor mental health at work, 39% of them was because of work being the driver of that poor mental health. So before COVID, we already knew that there was a real issue in terms of workplace mental health. And in terms of the cost, we knew that the cost to employers is around £45 billion every year. And we know that £29 billion of that is made up of presenteeism. So people not feeling at their best, but still being in the workplace, but not being able to be as engaged and productive as they could be if they were feeling better or getting the right support or in the right culture that was prioritising their mental health. And then COVID hit, and obviously we find ourselves in a completely new world. But what I want to touch on is the research that I just referenced that Business in the Community did last year. They revisited it last month. And in terms of those 2 stats that I shared with you, what they found is that actually the number of people or the percentage of people feeling comfortable talking about their mental health at work has gone from 51% to 56%. So that's a really positive sign that actually employees have felt more comfortable and confident during this coronavirus period to open up about their mental health and talk about that at work. And also the percentage of people that have experienced poor mental health due to work has gone from 39% to 41%. So that is a slight increase. But actually, I think that if employers hadn't have prioritised mental health as part of this pandemic, that number would have been much higher and that percentage would have increased much more. So I think we're seeing some really positive signs here. And I think that COVID is really providing us the opportunity to think about how we fundamentally design work for better mental health. And so today's webinar, as I said, is really focused on how you increase organisational confidence and capability to do some of the stuff that you need to make those improvements. And employers have been saying to us, what can we do now and what can we do into the future? So I'm really pleased to hand over to my colleague Dane, who's going to go through this standard in more detail. And as I say, we'll have an opportunity for question and answers at the end. So please do post those into the chat function. Thank you.
Well, thank you very much for that introduction, Faye. But by way of a more formal introduction, my name is Dane Krambergar, and I am Head of Workplace Wellbeing Services at Mind. So I oversee the team that delivers products and services to employers to help them to create mentally healthy workplaces. So that includes things like our Workplace Wellbeing Index, general kind of consultancy services, but then also mental health training, which is pretty pertinent to what we're going to be discussing today, which is the fourth standard in the Mental Health at Work Commitment Standards, increasing organizational confidence and capability. So what this really means is building employee skills and knowledge to promote well-being, support people with their own mental health, but then also helping employees support others. And that all leads to creating a more mentally healthy workplace, which, of course, who doesn't want that? So without further ado, I will crack on. Next slide, please. So for anyone who isn't familiar with Mind, we are a mental health charity, and our mission is fairly simple. We won't give up until everyone everyone experiencing a mental health problem gets both support and respect. And although our mission may be simple, it's obviously a very big challenge for us because 1 in 4 of us will experience a mental health problem in any given year. And we all have mental health, just as we all have physical health. Our mental health exists on a spectrum, so that can move from good to poor, up and down for any number of reasons. And work can play a real significant impact in a significant role and have a significant impact on our mental health. And we know that 1 in 6 workers is currently experiencing stress, anxiety, or depression in the workplace. And with COVID-19, there's all sorts of additional pressures that have come with that, with people working from home, working remotely, balancing that with childcare. So mental health problems we know have actually been exacerbated, or even some people have developed additional mental health problems as a result of COVID-19. So it's definitely a challenging time for everyone, and it's more important now than ever that we all look after our mental health. And one of the key ways that we can do that is through helping employees build mental health literacy and confidence, which is what this standard is all about. So next slide, please. So before I get into implementing the standard and what that involves, Faye did share some really helpful stats at the beginning about the picture of mental health in the workplace, and some pretty staggering figures there, but I thought I'd elaborate a little bit more on that before we jump into what we can do about it. But there's a real cost to doing nothing when it comes to mental health. So poor mental health, when left unchecked, obviously leads to having a negative impact on overall well-being, but as I say, there's a real financial cost to doing nothing. There's a cost to employers, there's a cost to the UK government, and of course, there's an overall cost to the UK economy. And in terms of the cost to employers, there's a number of things that have contributed to this. So there's an increase in the prevalence of mental ill health. And as I say, COVID-19 has had an impact even further on this. There has been a fall in sickness absence and a corresponding rise in presenteeism. And really what we'll see on the next slide is the real impact that has. But before we do, I also wanted to touch on the fact that 300,000 people are falling out of work due to poor mental health every year, which is pretty staggering. Next slide, please. So as I mentioned, in terms of the cost to employers, there are 3 elements here. So there's the cost of sickness absence, where people are too unwell to work. There's the cost of those 300,000 people who are leaving every year due to poor mental health. So the cost of replacing those people and temporary staff. But the biggest cost, and something that costs 3.5 times as much as absenteeism, is presenteeism. Now, why is that? Well, to explain it in a kind of really crude terms, imagine a 5-day working week where I'm feeling unwell and I take 1 day off to rest and recuperate for my mental health. And then I'm at 100% productivity for the remaining 4 days of that week. Now imagine instead of me taking that day off sick, I end up working all 5 of those days, but at 50% productivity. In scenario 1, the organization's getting 4 days of my time, and in scenario 2, the organization's actually getting only 2.5 days of my time. So that's where you can see that presenteeism can actually have a much more damaging impact on the organization than absenteeism is. As I say, that is a fairly crude example, but hopefully helps illustrate the point. And as I said, that really boils down to a cost to all employers. But in terms of the average cost per employee per year, that comes to about £1,652 per year. So if you multiply that figure by the number of employees that you have in your organisation, you'll probably get to what will be a fairly good approximation of what poor mental health is costing your organisation. And really what this all comes down to is, really highlights the case that it's so important for employers to be prioritizing mental health. And the mental health at work commitment standards really help provide all employers with a roadmap on how you can be tackling poor mental health at work. So let's jump into the first substandard within standard 4, which is increasing mental health literacy. So next slide, please. So this element within the standard is increasing mental health literacy of all staff and providing opportunities for staff to learn about how to manage their own mental health. So what do we mean by mental health literacy? Well, we'll cover that on the next slide. So in terms of mental health literacy, what this really means is boosting employees' knowledge and skills so they're better able to manage their own mental health, but also improve their ability to support others. So how do we build mental health literacy? Well, on screen, there are a few examples of how you can do this. This is not an exhaustive list, but hopefully will give you some ideas about what might be helpful. So the first is raising the profile of mental health. So one of the ways that you can do this is inviting a speaker to talk about mental health. So this could be part of an event on diversity, disability, or mental health awareness. Or you can invite someone who has personal experience of mental health problems. And that can really help break down the stigma that surrounds mental health and really brings it to life, having someone who's experienced it themselves so they can talk to others and really share that personal connection. And that really helps break down stereotypes as well. The second is sharing tips on looking after well-being. So 5 Ways to Wellbeing is a framework that you can use. It's something that was developed by the New Economics Forum, and it was kind of an alternative to eating your 5 fruit and veg a day, but for well-being. So the 5 Ways to Wellbeing can really help with provide a simple but effective way for employees to think of ideas that they can use to support their own mental health and well-being. The next is about making the most of internal communications. As many of us are working remotely, although some of us are still working in the physical workplace environment, there are so many different existing channels of communication that employers might have. So there could be your intranet, emails, or in the physical workplace, there's things like posters. There's newsletters, there's all sorts of different types of communication that are used within an organization, and using those channels to really effectively push mental health and wellbeing messaging is a great way of building literacy. So things like blogs and mythbusters, fact sheets, tips for managers, those sorts of things can be really, really helpful in raising awareness and building literacy. If you don't have mental health or well-being champions in your workplace, effectively these are people who play a really helpful and vital role in an organization of spreading well-being tips and sharing information. They can also be people that signpost others to support. So their role can be fairly informal or formal. It doesn't really matter, but the crux of it is that having mental health champions in the workplace can be a really great way of spreading the word and building literacy. So something worth considering if you don't have champions in your workplace at the moment. And then lastly, providing opportunities for staff to learn about how they can manage their own mental health. And that can be accomplished by doing things like workshops and courses. So things like how do you build your personal resilience, stress reduction techniques, mindfulness techniques. All of these things are going to be really helpful in building literacy. Next slide, please. So the second standard within standard 4 is ensuring that all staff are suitably prepared and educated to have effective conversations about mental health and where to signpost for support, including in inductions for all new staff. And really what this touches on is that information sharing is really helpful. It definitely is something that can help build literacy and raise awareness, but information sharing on its own is only half of the picture. Really having effective conversations about mental health is the next step in really achieving the standard. So that's just, conversations about mental health in terms of general awareness raising, but then also helping those to seek support if people are struggling. So training and resources are really helpful to then provide staff with this training on how to have those effective conversations. So for example, at Mind, we offer 2 courses, mental health awareness and mental health and how to support someone, which really do build skills and knowledge and some really helpful tools and tips for having these effective conversations with others. I also touched on in the standard the importance of inductions. Delivering an effective induction program is really essential. Starting a new role for anyone can feel unsettling at the best of times, and if employees aren't given the right expectations and guidance at the beginning, it can knock their confidence, and if they do have a mental health problem, it could be triggering them to feel worse. And so really, it's so important that every induction for staff members has a section on mental health and well-being. So this could include things like what initiatives there are in place, where they can find support, who they can speak to. And this can really help set a good foundation for that employee's journey as they progress through the organization. Next slide, please. So this third element is about line managers or people managers. Now, our relationship with our manager is such an integral part of our well-being at work in so many ways. That's because the things that affect our well-being at work and our mental health are things like our workload, taking time off sick, having reasonable adjustments in place, and those are all things that our manager typically has control or has influence over. And also, we know that from the research that we've done, our manager is the most likely person that we would disclose a mental health problem to, or someone that we'd speak to if we're struggling with our mental health. In fact, from our Workplace Wellbeing Index, we know that 74% of those who disclosed a mental health problem did so to their line manager. So it's so vital that line managers really feel that they have the right skills and knowledge and tools to be able to respond to the needs of employees really effectively and also promote mental health effectively. Next slide, please. So what does good training for line managers look like? Well, we think that it should cover a few different elements. So the first is how to spot signs and symptoms of poor mental health in line reports. So, what are the things to look out for? What might be some of the signs that someone is struggling? And particularly when we find ourselves in increasingly kind of a virtual environment, it becomes even more challenging to really identify when somebody might be struggling. So receiving training on what those signs and symptoms look like can be really helpful for managers to identify when someone might need some support. The next is about how to have an effective conversation about mental health. So, what a lot of managers and in fact a lot of colleagues in general feel that they don't want to say the wrong thing. They want to make sure that they are they're being useful and signposting to support. So how to have that effective conversation is really, really important. And as I just alluded to there, how to signpost to staff and offer reasonable adjustments. And reasonable adjustments can be something as simple as working more flexible hours. And then how to have an effective return to work conversation. So when somebody has become unwell and they are returning to work, that can be a real crucial point for employees coming back into the workplace, having that conversation with that member of staff and talking about the impact of them being off, what they might want to be focusing on coming back. So that transition point is a really key thing for managers to have to provide a good kind of foundation for that employee to return to work effectively. And then lastly, it's not just about being reactive as a manager. It's not just about offering support when it's needed. It's also about being really proactive and doing things like promoting well-being in a team, really role modeling good behaviors as a manager. So, taking lunch breaks, working reasonable hours, those sorts of things. That's really key for managers to be demonstrating what good looks like, essentially. Also, there's something that every organization needs to consider about training line managers, and that's those who might be more reluctant to talk about mental health. Whilst, as Faye said, things have certainly come a long way in terms of awareness has been raised, conversations are definitely happening more frequently and more openly, but still not everybody is on board with that, and a stigma does still exist around mental health. So it's important to try and consider how you engage those managers who may not necessarily be willing to go on training if it's non-compulsory. So you might want to consider whether training is mandatory for managers, for example. So in addition to training, whilst training can be really, really effective and helpful, it's also really important that every organisation has really clear policies and processes in place for managers. So we're talking about things like sickness absence policies or health and safety policies. So things that managers know when someone's struggling or when someone needs support, what are the correct processes that need to be followed within an organisation. So next slide, please. So the fourth and final part of the standard is this fourth one, which is supporting managers to think about employee mental health in all aspects of their role, including inductions, one-to-one meetings, team meetings, and return to work meetings. So it's very tempting for people and managers in particular to think about mental health as this separate thing, this additional responsibility that we all need to be thinking about, but really, for it to be effective, every single one of us, and managers in particular, need to be thinking about mental health as part of everyday business as usual. So inductions is one aspect, as I mentioned earlier. Having an induction within the organisation and mentioning mental health and well-being and talking about it there is important, but every employee that has an induction with their manager is also a really key, crucial point for managers to set those expectations right from the start and let employees know that as a manager, you care about mental health, it's a priority for you, that you are open to have conversations about mental health, because that can really strike the right tone and set the foundation for a good, healthy working relationship between managers and employees. Another really useful tool for managers is a wellness action plan, and actually there's a free template of this that you can download from Mind's website. But a wellness action plan, for anyone who's not familiar with it, is really simple but effective tool that managers and employees can have in place with each other. The employee completes a wellness action plan covering things like what keeps me well at work, what are the things that might trigger me to become unwell, and when I am unwell, what are the things that might help. And actually having something like that in place really helps the manager identify what course of action to take when somebody might be struggling. And it really means that individual is receiving tailored support for their particular needs, because the manager is aware of what their personal triggers might look like. Another element that managers might want to consider embedding into their daily practices is within team meetings, having at the start of each meeting a temperature check. So we do this a lot at Mind. We find it really helpful having everyone go around and say how they're doing, and perhaps giving a rating out of 1 to 10. What this really does, and as I said, we're working in an increasingly virtual environment for many of us. What that does is that it enables people to flag when they might be struggling, but then it enables managers to also spot when somebody might need to be followed up on. And I noticed you gave yourself a lower score. Is everything okay? What's going on for you? So it can be really simple, but really helpful in helping managers really understand when somebody might need support. Next slide, please. So another element is one-to-one conversations. So these are called different things in different organizations. One-to-one, some people call them supervisions or kind of formal check-ins. Really, what a one-to-one is having regular time in the diary to check in individually with every line report, and it's such an important aspect of effective people management. So we'd suggest that they take place at least every 4 to 6 weeks and last around an hour and a half to really get an effective conversation and get the most out of it. One-to-one meetings do have several benefits. So boosting employee engagement and kind of building that mutual trust between employee and manager. It's also a forum for employees to identify issues early so they can get support that they need. So having those conversations regularly really does help identify when things might be an issue before they become worse. So the third thing is also ensuring employee well-being is monitored throughout the organization. So having this framework that all managers are using means that employee well-being is monitored consistently throughout. So just to illustrate further the importance of one-to-one conversations of this nature, so our Workplace Wellbeing Index we captured some data on managers who regularly checked in on employees and versus those who didn't, and we found that for those who did have a manager that checked in regularly, 79% felt that their manager supported their mental health, whereas only 13% of those who didn't feel their manager checked in regularly supported their mental health. So it's really key that that whole process, that what could be seemingly simple as a process of checking in, can make a huge difference to somebody's well-being. So what does a good one-to-one conversation look like? Well, these can be fairly fluid depending on what needs to be discussed, but there are some key topics on the agenda that we feel are useful in having a good one-to-one conversation. It's not just about kind of workload and productivity, progress, priorities, that sort of thing. All of those things are incredibly important. They should be present. But there's also the importance of creating space for talking about well-being and how this might be relating to someone's work. So a check-in, just asking how someone is, but not just how are you, because you'll probably get the answer, I'm fine, but really specifically asking about that employee's well-being and their mental health and how their workload is, because that will usually elicit a more honest response that will be more helpful for that manager to then determine if there any action there needs to be taken. The other thing is about reviewing regularly what's gone well and why, and if there's any actions that might be needed, and also if there's anything that's not gone so well, and what might need to be put in place for that. The whole idea of reviewing key successes, what's gone well, it really does create that space for that employee to reflect on those things that motivate them and things that have enabled them to thrive in their role, and equally the things that may not have gone so well. What are the reasons for that? What might be put in place to mitigate against that moving forward? Also, managers who really want an open and transparent and effective relationship with employees, it's so important that managers, as well as giving feedback on the employee's performance, it's also about getting honest feedback from that employee on what they as a manager are doing. So in terms of communication style, support, etc., really honing in on what the manager can be doing better to support that employee. The next element is kind of issues, just general issues to discuss. So this can be more about the day-to-day, but it also provides an opportunity to then flag any issues that might be cropping up that need addressing. And then in addition to that, horizon scanning. So what's coming up in the future, any kind of key projects or crunch points. And that really helps managers to identify where there might be a need for support in future. So kind of preempting any potential issues that might be coming down the line. And I mentioned the 5 ways to wellbeing earlier, and one of the 5 ways to wellbeing is learning. And personal development is something that's often overlooked by everyone, whether that's managers or individuals. Personal development is such a key part of what keeps us well. The fact that we are growing and developing just in our roles, but in our lives generally. So having personal development as a recurring agenda item is really helpful in maintaining that focus on it. And then lastly, just the last couple of things. So hours and leave. So we know that taking regular breaks and having rest is really important to avoid burnout. So someone working longer or shorter hours than usual might also be a sign that they need support. So that is also really helpful to capture in that conversation. And if somebody is working particularly long hours, whether or not there's scope for them to be taking time off or flexible leave, those sorts of things. And then lastly, if an employee does have a wellness action plan, it is helpful to revisit that periodically. It doesn't have to be every single time, unless that would be helpful for the employee. But maintaining that wellness action plan as a live document, because as individuals, our needs will change over time, and what might keep us well and what might be triggers for poor mental health might also evolve over time. So it's helpful to keep refreshing that. And also reminding employees who don't have a wellness action plan that that tool does exist and they can take advantage of it if they so wish. So can we move on to the next slide, please? So return to work. So this is the last element of this standard. And as I mentioned, the return to work conversation can be a really, really crucial point for an employee in returning to work. I gave the example earlier, albeit a very crude example, of taking a day off work and then coming back and then being able to operate at 100% productivity. If only it was that simple. But really, when returning to work, employees want to feel confident that they're able to, they know what their priorities are. They know what the week ahead is going to look like. They know what's happened when they've been off sick, whether that's been off sick for a day, a week, a month, whatever it might be. Having that return to work conversation can really set the tone for what that return looks like. So it's also an opportunity for a manager to talk about return to work processes and procedures, talk about potentially having a phased return to work, so maybe slightly reduced hours for a period of time, or working on specific projects and not others. So really creating a plan for what that return to work should look like. Also asking what information that person wants sharing with the team. Not everybody's comfortable disclosing why they may have been off sick, so it's helpful to, from a trust and confidentiality perspective, really understanding what level of detail that employee wants shared with the rest of the team and getting that clarified. As I say, wellness action plans can be a really, really effective tool in one-to-ones, but also as part of the return to work conversation. If somebody doesn't have a wellness action plan, it's another point at which you can remind an employee, this is something that might be helpful for you, given that you've had some time off sick. Would you consider creating a wellness action plan? It's also worth, if somebody has a wellness action plan, revisiting that when somebody's returned to work, so that it's still being reviewed and make sure that it's still relevant for that employee based on why they've been off sick recently. And then for that period when they return to work, it may be helpful to have more regular check-ins than you usually would. Just even if it's fairly light touch, just how are you getting on today? That can be really helpful in maintaining that confidence and that morale in that return to work. So I'm just going to finish up on a couple of case studies before we move on to for a hand back to Faye. But the first is the Environment Agency, and for those who aren't familiar with the Environment Agency, so it's a non-departmental public body, and they really work to create better places for wildlife, people, and support sustainable development. They were actually our number one employer in our Workplace Wellbeing Index for 2 years running. So we thought we'd highlight the great work that they are doing to support employee mental health and well-being, and particularly the program of work that they have in place to build mental health literacy, which they call their Healthy Minds program. So there's a few different elements to the program that they run. One element is for all staff, so raising mental health awareness, building resilience, and the 5 ways to wellbeing training across the organization, for every single person. But then also specifically, the program focuses in on managers, so mandatory training on understanding and managing people with mental health problems. They also cover, as part of their training, things like the stress bucket and the mental health continuum. I mentioned the mental health continuum at the beginning of the presentation, but for anyone who's not familiar with the stress bucket, the idea being that we have only so much of a tolerance for stress, and our stress bucket fills up, and that's incremental as we get more and more stress piled on us. And if we don't have a really healthy release, so a little plug at the bottom of the stress bucket, our stress bucket can overflow. That can lead to burnout and crisis point. So those tools like that can really help illustrate the importance of looking after mental health and well-being, and how managers can play a role in that. So if we move on to the next slide. So I just want to finish up on these last 2 case studies. So when it comes to implementing mental health training, one of the biggest considerations for organizations is how that works. What's the format? And at Mind, we offer various types of training. We either offer it face-to-face. Obviously, given current restrictions with COVID-19, that's increasingly been virtual training instead as an alternative, but then also e-learning, which is completed by the individual at their own place, at their own pace even. And a lot of people think of e-learning as sort of death by PowerPoint. I really hope that's not how people feel on this webinar. But really what we've tried to do with our e-learning is ensure that it's as interactive and as engaging as possible. And that's a really key aspect for every employer to be considering how they roll out that training and what that format looks like. So in terms of the University of Aberdeen, they wanted to raise mental health awareness across the organisation, given that they have staff dispersed over a range of different locations and quite a high volume of staff. We thought that actually e-learning would be most appropriate for them. And I'll leave you to read the quotes at the bottom, just in terms of how effective that's been. But it just really illustrates that different employers will have different needs, different workforces distributed over different locations. So e-learning can be really effective in that scenario. But the NHS, the University Hospitals Birmingham even, they wanted to really train up their line managers. They have 800 line managers, but they were keen on taking a blended approach. So having face-to-face sessions in place for managers to really encourage that attendance, and having group discussions, sharing information, sharing tips, exploring case studies. That can all be really, really helpful in a face-to-face or even a virtual facilitated conversation. But then there's also that follow-up, that refresher learning, that kind of ongoing learning support, and being able to download certain resources and revisit particular topics. And that's where e-learning can really be beneficial. So the NHS really picked up a couple of mixed method approach from us for e-learning and face-to-face training, which really proved effective for them. So hopefully that's been useful. I'm probably going to hand back to Faye now to explore a different case study.
Brilliant, thank you, Dane. I'm really glad we finally unmuted you, because that was so excellent, packed full of useful practical hints and tips, which is what these webinars are all about. It's really important to set the scene, but we also need to make sure we give people really good practical advice about what they can do, and that was full of that. So thank you very much. So before we get on to the question and answers, I just wanted to share a particular case study related to kind of return to work conversation in the current situation. So we work very closely with Unilever, who employ over 150,000 staff. And I have to say that Unilever are an organisation that are doing some really brilliant things in terms of thinking about workplace mental health. And at the point where it was looking like more people were going to be going back to the office, they developed a return to the workplace conversation guide. And so this is actually hosted on the Mental Health at Work website. So they've shared it with us, and you can access it on the website. But even though we're in a slightly different situation now with people not returning to the office in the way that we thought they might, hopefully that will happen sometime in the future. So I thought it'd be good just to share some of the stuff that they highlighted in their guide, thinking about the current situation and how people can return to work. So what they did is they set out 3 steps for their line managers to think about. And step 1 was about line managers really preparing for the discussion that they were going to be having with staff about returning to work, recognising that for some people that was something that they were finding very anxious and worried about, that idea of coming back into the work environment. So step 1 was about how you prepare for the discussion. And then step 2 goes into how you actually have the one-to-one conversation with your employees. And what they did is they thought about the employees that were considered a priority to return to work, and then thinking about those who were not considered a priority. So focusing on those who were a priority first. But what they did is they set out a really clear guide on how to have that one-to-one conversation. And then step 3 was all about how you balance all the needs that those individuals might raise as part of that one-to-one conversation. So what they set out is they set out 4 steps that they wanted their line managers to be thinking about when they prepare for the discussion. And I recognise there's a lot of text on this slide, but as I say, there will be some more information on the guide on the Mental Health at Work website. But those 4 steps really, number 1 was what they were saying to their line managers is, before you have your one-to-ones with your team, make sure that you've had a conversation with your own line manager about how you're feeling about returning to work. Because obviously as line managers, we put a lot of pressure on those roles to support their workforce and their employees and the people they manage. But actually line managers themselves might be having those similar anxieties. So I really like the fact that step 1 was actually think about yourself and talk to your line manager about how you're feeling. And then step 2 was then to consider, have they considered the roles and the teams that are a priority and not a priority? But also, are you able to explain to people why they've been prioritised or not? And I think that's really important because, we recognise at Mine that we have people that want to return into the workplace for their own mental health, because actually being in that work environment is better for their mental health. And we have to recognise that everybody has different living situations. We don't know what's going on in everybody's lives outside of work. So they want their line managers to be really clear about why people have been prioritised or not. Step 3 was about them making sure that their line managers were prepared for their employees returning to the workplace and what those individuals require once they come back into work. And then step 4, what they were saying is actually if people are not returning into the kind of Unilever building, but they're going somewhere else, they might be working from other remote working places. Do you understand what needs to be done to make sure that those places are safe? So they really helped their staff think about how they could prepare for the discussion of return to work, and didn't just allow their line managers to go into those discussions without that preparation. And then what they did is they wanted to look at the kind of possible barriers that people might be exhibiting when they were having those conversations. So I thought it'd be useful to share some of the things that Unilever were telling their line managers to look out for. And so some of the things that they identified is that if employees were not able to think about anything else other than the virus, whether they were reporting that anxiety was interfering with their daily life, so they weren't going out and doing some of the things that they might be permitted to do, where they were isolating and maybe it wasn't necessary, but they were feeling like they just didn't want to see anyone or do anything. And then some of those other things that might be other signs of people experiencing poor mental health, not eating or sleeping well, feeling hopeless or angry, but also some of those physical symptoms that they might be showing. So what Unilever did is prepare their line managers to think about some of these signs and symptoms. So if they went into the conversation with their staff, they were able to maybe identify if people were feeling really worried and anxious and not feeling at their best. And then what they wanted to also do is they wanted to think about how they could balance all of the needs. And they kind of wanted to look at 3 areas. So it was really interesting to see that Unilever wanted line managers to watch out for possible signs of domestic abuse, because we know there's been a massive increase of cases and reports during the lockdown. And so for Unilever, it was really important that they gave their line managers some advice and information about what some of those possible signs might be if they were having conversations with people at home. But then also they recognised that because people might have got used to this way of working, and I think we've all proved that actually we can work quite efficiently working from home, that they use this as an opportunity to review working at home arrangements. And actually, if people wanted to work more flexibly and work from home, that there could be a conversation about this. But that led very much to point 3, which is, okay, if people are going to be working from home more, what is the home workstation setup? How do we make sure that people have got the right setup and are keeping themselves physically well, working in an environment where we're all crunched over our laptops, sitting in various places at home? So they really thought about supporting line managers to think about how they can balance people's needs. So I just wanted to share that with you because I think it's really important for you to see in practice an organisation that's really thought about how they can increase confidence in line managers during a situation like this. And as I say, that guide is on the Mental Health at Work website. So Unilever have been really pleased to share it with anybody else that wants to access that. So that's really brilliant. So now we're going to open up for question and answers. We've got sort of just under 15 minutes, and I'm going to invite Ewan, our colleague Ewan, who has been keeping an eye on the chat function. So Ewan is going to ask Dane and I the questions, and hopefully we can answer them for you.
Yes, hello there. There's a lot of discussion of all sorts of things in the chat. I thought I might tick off a few practical things first, because then we've got some kind of interesting things that you might delve into a bit further. On Dane's presentation, somebody asked whether you'd be able to make the slides available and we can put them on the site or send them by email. Would that be okay?
Yeah, no problem.
Brilliant, thank you. So maybe you send them to me and I'll make sure they get published in the same place. Somebody asked if there was a slide missing to support point number 2, being prepared and educated to have mental health conversations.
I don't think so. I think I was just reading off the notes, so sorry if there was loads of information and you were just staring at a slide and hearing me talk, but no, I don't think there was one missing.
Fair enough. But anyway, that's the advantage of publishing the videos afterwards, actually. We can a few on the particular tools and so on. Now, one of them I might answer myself. Somebody asked, is there a template for the wellness action plans, and could you repeat the name of those? Actually, in tomorrow's webinar, we're going to dive into those a lot more. Tomorrow is on presenting tools and support to your employees. So I can say, yes, the answer is there is a template. They are freely available, and we'll look at them in more detail tomorrow, but feel free to expand on that.
Yeah, I mean, the Wellness Action Plan is something that Mind have been delivering for many years, and it's such a simple but effective tool. And it's been redeveloped for people working from home, which I think is really important during this time. You can download it on Mind's website. We can even pop it in the chat for you. You can find it on the Mental Health at Work website. But yeah, it's a tool that we use at Mind, and I find extremely valuable for myself. It's not for everybody. Some people, don't want to fill them out, and that's absolutely fine. But for organisations that kind of really want to think about the individual needs of people, it's a great tool to use.
Thank you. And then one last one on tools. Somebody asked, do you still offer free e-learning for charity and not-for-profits?
Dane, you want to take?
I was like, oh, we're going to jump in. We do. So currently, the free e-learning that we have is for small workplaces, and that's currently undergoing some maintenance. But we hopefully will have that available back up and running soon. But we so that is available for free. In terms of other e-learning that we do provide some decent discounts for charities and non-profits on e-learning. So that is available as well.
Okay, thank you. So yeah, as I said, some bigger topics now. Somebody said a question to Faye. It was fascinating that presenteeism was the biggest cost. How do we address that directly? Should we really be sending people home as so many staff turn up just because they feel pressurised to be here?
Yeah, so I think there's a couple of things for me on the presenteeism front. So I think, firstly, the way that I would describe where we had got to before COVID hit is that many organisations were doing some brilliant stuff and we're starting to kind of move the dial. But what I would say is that they were focusing on what we would call probably the low-hanging fruit, the stuff that is quite easy to do, because let's all face it, this stuff is really tough and really hard. But I think where we were getting to before COVID is that organisations were starting to understand that to really improve the way that people think and feel about their mental health at work, you need to tackle the fundamental causes of poor mental health in the workplace. So you need to move away from just doing the low-hanging fruit, and you need to fundamentally think about how you design work, how you design the physical space, how you manage work-life balance, how you allow flexibility. All of the things that really drive poor mental health are the things that organisations need to tackle if we're really going to improve how people feel in the workplace. And for me, I think that's going to have the biggest impact on presenteeism. And I think for me, there is a really strong argument to say that if somebody is not feeling well and they need to take time off sick, we should absolutely be encouraging them to do that if that's the right thing for them to do. But if actually that's not the right thing for somebody to do, we know that being in work can be hugely positive and beneficial for people's mental health. So we should absolutely be trying to create the culture where somebody can get that support and remain in work if that's what they want to do. So it is going to be very dependent on individuals, and everybody, is affected differently in terms of their mental health. But we absolutely have to create the cultures where people feel like they're coming into work, feeling engaged, feeling motivated, feeling productive. And, we can only do that if we really get to the kind of tackling the causes of poor mental health and not just focusing on the kind of quick wins, tick off, easy stuff. And I think that COVID is providing that opportunity, because I'm seeing more organisations think about that kind of bigger, crunchier, how do we create the right environments, because we've been forced to do so. Dane, anything to add?
I think you covered it very, very nicely there, Faye.
Okay.
Oh, thank you. So 2 left. Again, on the research stuff you talked about, somebody has asked, what are the gaps in the research related to effective relationships with managers and the likelihood of an individual disclosing their mental ill health? What is it that we still need to find out?
It's a good question. I guess what we do know is the importance of managers, as we talked about, the importance of them having the skills and confidence to have effective conversations to promote well-being effectively. There's one thing that is quite challenging for people to really drill down into is the subject of emotional intelligence. It's something that it's a subject that has a fair amount of research into it. And emotional intelligence, for anyone who's not kind of familiar with the term, is really an ability for an individual to identify what somebody else might be experiencing themselves. So spotting those signs and symptoms. And some people think of emotional intelligence as something that is kind of innate. Some people think of it as something that can be developed. I think there might be something more in the way of researching the role of emotional intelligence in spotting signs and symptoms and support. I think there's also something about kind of cultural differences when it comes to mental health. We know from various pieces of research that there can be different language used when it comes to mental health. Certain communities prefer the term emotional health, for example. So there's something around whether or not those language differences or those cultural differences play a role in how effective a manager can be in supporting themselves, but also different cultures within the team that they manage.
Yeah.
I don't know if you want to add anything to that, Faye.
Yeah, I think I would just say that I think we know that the kind of middle management role often feel the kind of pressure in terms of being that kind of role that has to adhere to making sure that the organisation is delivering, performing, that they're kind of following policy and practice, but also that role in making sure that they're supporting their teams. And so for me, there's something about how do you create a psychologically safe environment for those middle managers where they feel like they don't have to just be led by a policy that's 5 pages, black and white, and actually doesn't allow for them to be human in some cases. So for me, there's a real piece of work there about that level of line management and how you create a psychologically safe environment where they can actually be human and manage their staff in a more authentic way. And I think that's maybe where we get stuck a little bit. And I think we put a lot of pressure on that group of people, and I'd like to see more work done in that space.
Well, thank you. And that actually links really nicely onto the question that I saved for the end. On the issue of mental health literacy for everybody, how do organisations engage harder to reach staff, i.e. people beyond the usual suspects who are already bought in?
Yeah, it's a tricky one, isn't it? Because whilst you want to try and strike that balance between making sure everyone has access to the same information, there are going to be people who aren't always bought into the same subjects. And this is where we talk about, as Mind, as a charity, we talk about embedding mental health into every aspect of work. It's not just this thing that's a talk or an exercise class or a fruit bowl. It's something that is core to every aspect of work that we do. And the more embedded it becomes as part of the day-to-day of an organization, the more those harder to reach people are going to be exposed to those messages, that training, that culture of inclusivity and openness. And that can be one of the most effective ways in engaging those harder to reach people. Obviously, you could be a bit more sort of draconian and be like, you will go to that training, and that can work. But ultimately, if people aren't willing to engage with the subject, they won't, no matter how much mandatory training you put on. Having that culture piece in place and making sure that's embedded throughout is really the more effective way of engaging harder to reach people.
And I would just probably add, I think as soon as you use the term harder to reach, you've lost. Because actually I think that it's not about people being harder to reach, but we're not going to the places where those people are, and that we need to go to those places and reach out. So, the first question is, why are they harder to reach? Is that our perception or is that the truth? So for me, there's something about the work that you do in trying to get feedback from your employees about the issues and challenges they're facing. Make sure that you think about a variety of different ways that you could do that. We all know about the yearly staff survey, and it's a valuable thing, absolutely. But I also know that if I did it on a Friday compared to a Monday, you'd probably get a very different result from me. So at the moment, really doing those pulse checks, doing those regular check-ins, actually going to the different forums that you have in your organisations to ask groups of people how they're feeling, what their issues are, what they want from the organisation. I truly believe that people are not hard to reach. We just don't try hard enough to reach them. So that would be my reflection on that.
Well, thank you. That reminds me of a poverty researcher I know of who, whenever they see the phrase hard to reach in a document, they press find and replace and swap it with easy to ignore. It's worth thinking about.
Yeah.
Well, thank you. That's the end of the questions. Anything either of you would like to say to finish?
No, I would just like to say thank you, Dane. Thank you for your input. Really, really, really brilliant. And thank you, everybody, for joining today. As I said, this is the 4th webinar in the series. We've got 2 more to go. They are all going to be on the Mental Health at Work website. So you can access them again. You can share them with your networks and your colleagues. I think it's really important to say that we're here as Mind. We're here to support you. So if you want to know anything more about what we do in this space, please visit our website. We have lots of information on there about workplace wellbeing. And the last thing that I would say is be kind to yourself, be kind to each other. It's been a really tough 6 months, but we're all in this together and we're all here to support you. So have a great rest of the week and thank you so much for joining.
Thanks, everyone.
Thanks. Bye.